Today I want to tell you a story about Christopher. When Christopher was 7 years old, his mom gave him a couple of dollars and sent him to the corner store to buy a loaf of bread. When Christopher arrived, he was very quickly surrounded by a group of boys who were just a few years older than him, who beat him up and stole his money. Christopher was distraught and he ran home crying, and when he found his mom turned to him and said, "Christopher, toughen up." She said, "You will never survive in this community if you don't learn how to fight back." So she handed him a couple more dollars and she sent him back to the store to confront the boys. So I want to pause and just give you a moment to reflect on what you think Christopher's future might look like. What is the likelihood, do you think, that he might pick up a gun to keep himself safe? My name is Sara Thomas. I work at the Health Disparities and Public Policy Lab at Northwestern Feinberg School of Medicine. We've been following Christopher and more than 1,800 other youth for more than 25 years. We first met them in a juvenile detention center, and we've been tracking them and interviewing them as they've grown up. One of my major projects is exploring safety challenges that young people face, the strategies they use to stay safe, and where guns fit into that puzzle. The numbers look dire. More than 3/4 of our male participants had been threatened or shot at with a gun prior to turning 18 years old. 1 in 4 of our male participants regularly carried a gun outside the home prior to turning 18. But some of our participants, including Christopher, managed to grow up and lead relatively safe and successful lives. So what creates that? We want to understand the risk and protective factors, things in people's social environments that either support or hinder development. This might include people's individual traits, their personalities, things that are happening in their families, in their schools, in their neighborhoods. So if we look back to Christopher's story, Christopher was automatically at higher risk because he was a male in a highly violent community. Add to that the fact that he had a family who condoned and even encouraged the use of violence. When I talked to Christopher, he also talked to me about the fact that he was really disinclined to engage in violence. He didn't like it. And although he did confront those boys that day at that store, ultimately he found refuge in his local public library and was able to spend time there and befriend people who had a different perspective about violence. So our hope is that through continued understanding of the messages, the opportunities, and the risks that young people are facing, we can begin to reduce community violence. We can advocate for the policies and practices that help young people like Christopher grow up to lead healthy, productive, happy lives.